Mr. Lewis, your former boss, Senator Max Baucus, was the chief congressional author of the Affordable Care Act, or Obamacare. Polls show the law is widely unpopular. What role, if any, did you play on the bill? And I'd like to ask you and the other candidates, what's your assessment of the law and what would you do to fix it?
Sure. Thanks, Chuck. Thanks, Tom. I want to thank Montana Tech. It's great to be in Butte, America. It's exciting. And I want to thank the school for hosting this debate. I want to thank Senator Zinke and Mr. Fellows for their service and participating in this debate. I also want to recognize and thank my family that's in the crowd here, my wife, Melissa, and my two kids, Kate and Jackson. They've been with me every step of the way and couldn't do it without them. Look, as the father of two young kids, I want the same thing for my kids, for all of our kids, that I had growing up in Montana. I was born and raised in Montana, and whether it's good paying jobs, education, I want that for all of our kids. And I'm proud of my service to the state. It brought me to all corners. I got to help communities that work on, that were ravaged by floods, ravaged by wildfires, work on legislation to help veterans. But this race is about the future and who's got the best vision for the future. Look, in this country, we pay too much for health care. We can all agree on that. Healthcare costs are too high. And one of those reasons for that is because there are millions of Americans in this country uninsured that get health care, and those costs are spread around to the rest of us. And so what has happened? A law was passed, well-intentioned, to try to insure more Americans, bring down costs. Did it fix our healthcare system? No. But can we continue to improve on our healthcare system? Absolutely.
Mr. Zinke, your answer?
Well, I'm a combat veteran and not a community organizer, and I appreciate John's intent of the Obamacare, and I also understand that you were an architect of it. But I choose my words carefully. I say abandon it. And as a naval officer, when you abandon a ship, you just don't jump in the ocean. What you do is you go to a different vessel. And with Obamacare, some of the problems we have is there are a couple good things. I mean, pre-existing conditions is a good thing. But more bad things, because it took a bad system and made it worse. So when you look at how to make it better in Montana where it's rural, I think you're looking at things like co-ops for small businesses to make sure that we can pool. You look at tort reform, health savings accounts. There's a lot of tools that you can do to make healthcare accessible and affordable. Unfortunately, Obamacare makes it worse. So I do think there's a fix. And look, America's a fourth quarter country. I think I'm an optimist. I think we can rebuild her. I don't think that the best days are behind us. I think the best days are in front of us. But first of all, we have to be Americans first, and then look at the solutions on truth and find real solutions that make a difference. And I think they're out there. So there's a lot of tools you can do. Unfortunately, the construct of Obamacare as it sits is not constructive, and it makes access to health care worse.
Mr. Fellows, your answer?
Well, I want to first thank everybody for being here and the Montana Newspaper Association for inviting us. But I don't think Obamacare can work. As we noticed before, it was over 100,000 page bill that nobody read. Nancy Pelosi said we had to pass this thing in order to see what was in it. But we need more free market ideas. I mean, for myself, I'd rather much have a cafeteria type plan where if I want to pay for the little things, I can do that. If I want to pay for the catastrophic insurance, well, I can do that as well. I'm part of a nonprofit organization, and our healthcare costs are going to go up $15,000 this year because the plan keeps on changing based on what Obamacare has in it. But there are some free market avenues for that. In Oklahoma, they have the Surgery Center of Oklahoma. When you go down there, if you have carpal tunnel, their charge for the surgery is probably only about $2,500. If you go to the hospital down the road with the administrators and all the bureaucratic mess, it's about $15,000. And so a lot of employers skip the insurance on some of that stuff, and they just pay for it short waves. And there's also things like Simple Care that are trying to get rid of insurance altogether and just take a fee for service. So there are some free market ideas that will work in this thing if we just look at them.
Mr. Lewis, your response?
Look, the fact of the matter is that thousands of Montanans are benefiting from the legislation, including kids who were denied health insurance because they had pre-existing conditions. Seniors who were paying too much for prescription drugs because they were caught in what's called the Medicare prescription drug hole. Look, we need to continue to talk together. I'm somebody willing to work with both sides to continue to improve our healthcare system. And what are some ways that we can do it? Well, number one, we got to talk about healthcare again and be able to work with each other. Let's give states more flexibility to innovate and drive down the costs and increase coverage. You hear about the burden of paperwork. Let's reduce paperwork. Let's fix that. But what's not an option is holding 50 votes and to repeal and go back to what? We don't ever hear a solution to fix healthcare costs in this country and ensure more Americans from the other side. So I'm about solutions. Let's continue to fix our healthcare system and move forward, not backwards.
Mr. Zinke, your response?
Well, I do believe there are solutions out there. And I think looking at co-ops, again, for small businesses to pool, tort reform, making sure you have individual health savings accounts. There are a number of tools that are appropriate to make sure we have access to quality health care. Obamacare, unfortunately, is about billing. You're not given choice. There's no innovation. It penalizes prosthesis, for veterans. It penalizes, medical equipment. There's a lot of penalties in there, and so I do believe there are solutions, certainly better solutions than what we have. The unfortunate part is how Obamacare came to being. There was no Republican vote. It wasn't sitting down together and forming a healthcare system for America. We're the finest country in the world. We should have the best healthcare system. But it wasn't. It was a one-sided vote, and it was jammed through. So we talk about working together, but proof, is in doing it.
Mr. Fellows, your response?
I mean, I think healthcare in this country, at least Obamacare and Medicaid and Medicare, I think there's got to be a lot of things that we need to fix the system with. A friend of mine whose mother needed a walker, Medicare would pay $50 a month for the 2 or 3 years that she lived after she got it, but to get a walker would cost you about $50, and so that's money that we're wasting, I think, on healthcare itself. And of course, we can always blame the third-party payers, of course, the government, the insurance companies, obviously. And we saw what the healthcare costs in Massachusetts under Omnicare and under Tennessee back in 2000. The governor was thinking about instituting an income tax just to pay for health care, and so that's the problem. But we're always going to see the costs, and we've got to control those costs.